Kind enough to join us in studio is our good friend Dr. Joe Congeni, Sports Medicine Center at Akron Children's Hospital. Joe, I know you wanted to talk a little bit about knee injuries.
Yeah.
How some are more severe than others and the names and that type of thing. Go ahead.
Yeah. One injury that we see a real lot this time of year in a pediatric sports medicine center. So we see pre-high school, high school, college athletes. And in that population, a knee injury that's seen very frequently but misdiagnosed often is a patellar dislocation, a kneecap dislocation. Kids do get a feeling of a pop when they get it. They get swelling because if it's a bad enough dislocation, they'll tear the ligament that holds the kneecap in the groove. So it'll tear and swell. And so it's very often misdiagnosed as an ACL. And there will be swelling and pain around the kneecap with movement of the kneecap. Kids can return to play with it, though. Often they'll play that same day with it, and it swells a lot. And then they'll want to return the next day in a brace and other things or within a week. And then what they do is they stretch out the ligaments so much it never really heals back down. And here's an injury that should respond to rest and physical therapy, relative rest and physical therapy, that ends up 3 months, 6 months down the road needing surgery because the kneecap is so loose or unstable. So it's an injury that needs good treatment and good diagnosis, and it is misdiagnosed a lot as an ACL tear or torn cartilage in the knee, but really you can differentiate if you're in sports medicine quite a bit to see this pretty common patellar dislocation.
And what's the difference in recovery time?
Well, the difference in recovery time is with 2 to 3 weeks of relative rest, physical therapy of getting the strength back and bracing. Kids can play and do very well, and the ligaments should heal back and tighten up pretty well, and kids go upon the rest of their career and do well. The problem with an ACL, it's one ligament that just doesn't heal very well, and it needs to be fixed surgically. And by the same token, the opposite is made. Because we see so many patellar dislocations in the pediatric world, I see a lot of people that are seen by others who are called a patellar dislocation, and they're actually an ACL. So knowing the difference between those two, big difference. Out 2 or 3 weeks with some rehab and bracing and back to play versus out for 6 to 9 months with a reconstructive surgery. But in our world of sports medicine and pediatrics, it's probably 4 to 1 patellar dislocations more common than an ACL. So it's very common in kids.
You go back 10, 15 years ago, when you heard about the kneecap being dislocated, you would just cringe and say, oh boy, he's done for a while, huh?
Pretty painful injury, but you'd be surprised how quickly you can get that swelling down and in an appropriate, well-fitted brace and with some rehab to strengthen it back up. But the mistake people make, they sit 2 or 3 days, they want to go back right away, they maybe put a brace on, a brace isn't good, and then they keep re-tearing that ligament and they keep redislocating the kneecap, and then it becomes a surgical problem a couple of months later.
With us is Dr. Joe Congeni, Sports Medicine Center at Akron Children's Hospital. Let's get to the Cleveland Indians on the tip of so many tongues. By the way, enjoyed the pictures of you at the game last night. But let's go to Corey Kluber. Yeah. Came back and pitched in Game 2. Looked pretty darn good. And you were telling me that the quad injury he had was one of the 4 muscles?
Yeah, so quad means 4, and the 4 muscles in the front of the thigh, they actually, back the last week of September of the season when he felt that tightness, they need answers in this population, especially at this time of year. They went ahead and got an MRI on him from a couple of articles that I read, and only one of the 4 muscles showed any inflammation at all. So this isn't from we talked a week or 2 ago about in soccer players, how they get kneed in the thigh and they bleed in the thigh and This is from an overstretch to that muscle, and only one of the 4 muscles, and only a mild, they use the term mild inflammation, of course, whatever you're told, about injuries, but a mild inflammation and swelling and overstretch of the quad for Corey Kluber, that was a big deal for us. Luckily, he had a lot of time off between that last week of September and his first outing, which was Saturday, and people actually clocked him versus the rest of the season, and he was down about 2 miles an hour on his fastball, 93 plus to 91 plus miles an hour on his fastball. Boy, but he sure looked in command of the rest of his pitches, and here we go again. He gets another 7-day rest. He pitches on Friday afternoon. If he starts game 1, which I'm hearing he is supposed to do, then he pitches another 7-day off. That's a lot more than he gets during the regular season. He's pretty sharp. His command is good. He's pitching at home. That's pretty good news. But from the standpoint of the quad, it's very important. You and I talked about it about midsummer with your team. People don't understand the connection of how important the legs are, the thigh is, the core is in a pitcher. Absolutely critically important. And so because he wasn't able to push off as hard as he was, they said he may have lost a few miles an hour on his fastball.
Baseball is a total legs game, if you ask me.
It is.
Okay, I'm not asking you to get real specific here, but Danny Salazar was shut down, arm strain. He's starting to work back. What I'm asking, or maybe it's case by case, how long does it take? Let's say the arm is feeling well for a major league pitcher to build that strength up where they're able to come back and be a factor in pitch.
Yeah, they are talking about this clandestine Danny Salazar rehabilitation going on in Arizona. There's probably people with cameras and stuff trying to figure out the secrecy of the Indians getting this guy ready, because he could possibly be helpful in series number 2 or series number 3.
Yeah, because the roster's not officially set yet.
The roster is not set yet. I'm sure they're down there in simulated situations of seeing him pitch. I'm quite certain that he wouldn't have enough time to get ready to be a starter again, but they really do feel with the liveliness of his fastball and stuff, he could help with a couple of innings from what I hear. And what they're looking at is him throwing, and as he's been throwing and getting stronger each week down there, they have really taken away from him throwing any breaking pitches yet at all. He's just working on the hard stuff right now, and that with only the hard stuff, he'd be just a relief type pitcher. What makes him so great is he has a pretty good curveball and pretty good off speed. He hasn't even started to work on those pitches yet. So what does that tell you about breaking pitches and elbow problems? That's the last thing you work on. The first thing you work on is just getting your velocity and command back. If he doesn't get his velocity and command back, he's worthless to you. So they're working on that, and I think what we said last week, I think in the range of 3 to 5 weeks is generally what we're looking at when somebody's been totally shut down to be able to pitch again, and then to be able to work back enough innings to start. It's more like 6 to 8 weeks. Well, we don't have 6 to 8 weeks. I think they're looking for him in more of a relief type role.
All right, good stuff, Joe. Thanks for coming in.
Okay, Ray, thanks.
There you go. Good insight there. Dr. Joe Congeni, Sports Medicine Center, Akron Children's Hospital.